Kentucky can create a brighter future for all of our children. That effort requires all of us and many different types of solutions, including state policy change. The Blueprint for Kentucky's Children is a coalition of nonprofit, public, and private organizations from across the state that speak with a common voice to advocate for policies and budget investments that can create the future we all want to see for Kentucky kids. The Blueprint stands on 3 pillars. Thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. Each year, the coalition creates a shared agenda of policy and budget priorities to present to the Kentucky General Assembly. The 2025 Blueprint for Kentucky's Children policy agenda includes the following proposals to help improve the outcomes of kids and families across the Commonwealth. Every child deserves a safe learning environment, free from abuse and exploitation. In Kentucky, 61% of teachers who lost their licenses between 2016 and 2021 did so due to sexual misconduct, underscoring the urgent need for stronger protections. Kentucky can protect its children by implementing thorough reference checks, requiring disclosures of any past misconduct, and disallowing the use of non-disclosure agreements related to abuse or exploitation. These measures help ensure that educators and school staff uphold the trust placed in them, creating a safer, more supportive space for Kentucky's children to learn and grow. In today's digital world, Kentucky's children face increasing threats from online predators. Sexual extortion, or sextortion, has shifted from offline to online spaces, where predators use social media gaming sites and messaging apps to target vulnerable youth. Often posing as peers or romantic interests, they coerce victims into sharing explicit content and then demand money through threats of exposure. With 54% of minors perceiving online grooming as common among their peers, Kentucky must act by establishing sexual extortion as a felony, educating families about online risks, and ensuring schools notify students and parents to help create safer digital spaces for our children. Youth across the state are using nicotine products like vapes and nicotine pouches at alarming rates. And despite the legal purchase age of these products being 21, many students still report buying tobacco and nicotine products directly from a retailer themselves. Kentucky can prevent youth initiation and keep these addictive products out of the hands of kids by requiring retailers to maintain a license to sell these products, conducting regular compliance checks, and penalizing those selling to kids. And to support kids struggling with nicotine dependence, Kentucky can direct dual settlement funds to prevention and cessation programming to help youth quit. Kentucky can support the development of young children with special needs by requiring training for childcare providers and incentivizing programs to serve children with disabilities. In a recent survey conducted by KYA, more than half of childcare directors stated that they had expelled a child in the last 12 months due to challenging behaviors. Those same directors stated that they could accept more children with disabilities into their program if their staff had more training. All childcare providers are required to have annual training hours, some of which could be focused on how to best serve children with disabilities to help teachers feel equipped to support these students in the classroom. Kentucky kids' health and well-being starts before they are born by prioritizing their mother's access to high-quality prenatal and birth care in a setting of their choice. Kentucky can expand access to safe and healthy prenatal and birth options to help reduce inequities in maternal mortality rates. Freestanding birth centers offer a home-like environment using the midwifery model of care and few medical interventions to provide high-quality, safe care to birthing women. By removing barriers to opening and licensing freestanding birth centers, Kentucky can offer safe, equitable options for mothers to choose from when pregnant and during childbirth. As kids get older and exert more independence, they still need support and guidance from the adults in their lives. However, when kids get in trouble, there aren't any laws requiring them to have an attorney present or to even speak with an attorney before being questioned by the police. This means that kids who aren't old enough to drive or vote are expected to make consequential legal decisions on their own. By prohibiting minors from waiving their Miranda rights until they speak with an attorney, we can ensure that their basic legal rights are protected and they're making informed decisions about their futures. Far too many Kentucky kids have endured the trauma and disruption of having a parent incarcerated, with 2022 data showing more than 115,000 kids experiencing it at some point in their lives. Parental incarceration is an adverse childhood experience that's associated with increased mental and behavioral health challenges, poor educational outcomes, and a higher likelihood of experiencing other ACEs. We know that people need to be held accountable for their actions, and there's an equally important need to find the right balance between applying consequences that match their actions and considering the impact that incarceration has on their kids. Children thrive when they have healthy and stable relationships with their parents. By expanding the court's sentencing options for community-based alternatives, parents can be held accountable in ways that minimize the negative impact on their children. All kids deserve a safe and stable home, but the rising cost and limited availability of housing has made finding and staying in safe, stable housing difficult for 44% of Kentucky renters, which puts them at a higher risk of eviction. Families with children are 3 times more likely to be evicted than any other households, and nearly 1 in 7 kids experience eviction before their 15th birthday. An eviction record is created when a landlord files a claim, and even if the case is dismissed, it permanently appears on the tenant's housing record, creating lifelong barriers to securing stable housing. Sometimes minors are even listed on eviction filings, causing irreversible damage to their housing record before they are even old enough to sign a lease. Kentucky can promote family housing stability by making common sense changes to the eviction process to seal filings that do not result in an eviction and prohibit minors from being named on eviction filings. Housing stability also requires access to basic utilities such as gas, water, and electricity. The monthly cost of utilities in Kentucky has increased by 33% since 2017, making it harder for households to keep up with their bills and making utility disconnections more likely. Households with young children are more likely to struggle to afford utility costs and are 3 times more likely to experience utility disconnection. When families struggle to afford basic utilities, children are at a higher risk for respiratory conditions such as asthma and experiencing heat-related illness or death. Kentucky can follow the lead of other states by establishing standards to protect children and their families from utility disconnection during extreme hot and cold temperatures. Kentucky lawmakers have several opportunities in the 2025 legislative session to make policy decisions in the best interest of kids and families. As a shared voice, we can achieve so much for kids. Are you ready to take action? Visit kyouth.org/blueprintky to find your state representatives, learn more about the Blueprint for Kentucky's Children priorities, follow action alerts, and track the progress of bills that are good for kids.